In 1916, the great Russian dancer and choreographer Vaslav Nijinsky toured the United States with the Ballet Russe. Nijinsky's performances generated tremendous excitement. His execution of the dance was judged flawless. Because of his remarkable talent, many called it genius. He became as celebrated in the United States as he had been in Europe. During this triumphal period, however, friends began noticing changes in Nijinsky's personality. He had uncertain fits of temper and flew into rages when other dancers could not execute the steps he had devised. A close friend, Anatole Berman, commented, "A further penetration into the abstract haunted his disordered mind with absurd creations based upon geometrical planes, cubes, triangles, and spheres impossible to execute in a three-dimensional world." The new modernism, he thought, must bring into physical manifestation a fourth dimension that, alas, seems to have swallowed his mind and his art into its mystic, impenetrable realms. Nijinsky's break with reality continued until at last he was unable to function in society. His brilliant career came to an untimely end. Vaslav Nijinsky was afflicted with schizophrenia. Schizophrenia is a complex disease of the brain that is characterized by emotional withdrawal, by highly disordered thinking.
If the vibrations would just line up the balls long enough for me to understand the concepts, then I'd have some. I'd probably be a millionaire.
And by bizarre thoughts and behavior.
But you know something, though?
No, what's that?
I shot Richard Nixon.
No, well, I know you think you do, but
No, it's not what I think I did. I know I did.
The exact nature of this disease is still a puzzle, much like this one. Over the years, researchers have been adding information, bit by bit. Slow at first, the process of understanding the disease has grown and accelerated as more pieces are put into place. Many researchers believe schizophrenia may be due to several different disease processes having similar features. An analogy might be fever. Individuals with a fever have similar symptoms: high temperature, flushed face, and often aches and pains. And a fever may be due to a variety of causes: an infection of the lung or kidney, or a reaction to a drug. On the other hand, some authorities believe schizophrenia may be one disease with a variety of signs and symptoms. The word schizophrenia is derived from schizine, or split, which originally referred to a splitting in psychic function, an inconsistency, inappropriateness, and disorganization of feelings, thoughts, and actions. But schizophrenia should not be confused with a split or multiple personality. That rare disorder, the subject of several popular books and movies, is another condition entirely. Knowing the epidemiology of schizophrenia is a good starting point to understanding this complex disease. Schizophrenia is found in all types of societies, across all races, cultures, socioeconomic classes, and geographic locations and climates. When areas of the world are compared, however, there are different prevalence rates. For example, the rate in Western Ireland is considerably higher than in Northern Ireland. In the United States, it is estimated that 1% of the population has been, is, or will be affected, and that between 2 to 4 million individuals presently alive will develop the disease. Schizophrenia has its onset usually during late adolescence and early adulthood, with about 75% being between the ages of 17 and 25. The disease is diagnosed with equal frequency in women and in men. However, schizophrenia occurs about 2 to 3 years earlier in men and appears to be more debilitating to them. They seem to have a higher relapse rate, and their adjustment in terms of factors such as marriage, job capabilities, and social life is not as good as in women. The disease is 8 times more prevalent in individuals in the lowest socioeconomic group. It's also more commonly seen in individuals raised in urban areas. Although the exact reason for this is unknown, it's theorized that city life may expose vulnerable individuals to some unknown environmental agent that causes schizophrenia. Because schizophrenia is usually severe, persistent, and extremely disabling, most who develop it have residual or recurring symptoms. It is costly to society. In 1 year alone in the United States, it was an estimated $35 billion. And of course, its cost in terms of human suffering is incalculable. Parents and siblings undergo the anguish of watching young adult children, so full of hope and promise, slowly and subtly undergo a deterioration of ability and an unraveling of personality.
Come on, hurry up, let's go. Before Mom comes in. Come on.
Parents and siblings are usually burdened with trying to care for these grown children who, in addition to having the bizarre disordered thinking that is characteristic of the disease, have poor judgment, little motivation, and few social skills. But it is the individuals themselves who endure the greatest hardship, often experiencing unrelenting misery caused by their disabling symptoms. They frequently experience intense frustration and endure lives of intolerable loneliness. About 1 in 4 attempts suicide, and 1 in 10 of these is successful. Suicide is often a result of depression, which may coexist with schizophrenia. As is true of the general public, completed suicide is much more frequent in men. The mortality rate from other causes is also significantly higher than in the general population. Because of problems such as confusion and short attention span, as well as an inability to access care and accurately describe their situation to medical personnel, these individuals are far more likely to die from conditions such as infections and accidents. Some also suffer from drug or alcohol dependency, which greatly complicates their rehabilitation. Estimates vary from 30 to 50%, with higher percentages in individuals in acute care settings. Those who are chemically dependent are more likely to have unstable housing, irregular eating habits, and not to take the medications needed for control of symptoms. They are twice as likely to return to a psychiatric hospital within a year after being discharged. Substance abuse obviously complicates an already difficult situation. Let's highlight some of the pieces of information we have so far. Schizophrenia is a severe and persistent disease of the brain. It causes social withdrawal, disorders in thinking, and bizarre thoughts and behaviors. It develops in late adolescence and early adulthood and usually results in residual disability. It is extremely costly, both monetarily and in terms of human suffering. Theories regarding the cause or causes of schizophrenia have been postulated by scientists from a wide variety of disciplines. 30 years ago, it was widely considered to be a psychological disease caused by toxic family interactions, poor parenting, and other dysfunctional family relationships, with the mother being particularly at fault. Although there were few real research studies to support these theories, they have been repeated in textbooks and classrooms for many years and may still be found today. Jean Sanchez, an advocate for persons with mental illness and whose son has schizophrenia, discusses a recent experience.
Even as late as last week, when I spoke to a friend of mine who administers a board and care, and she was interviewing for staff, and she asked one of the potential staff members, "What do you think the cause of schizophrenia is?" And that person, who had several degrees, said, "Well, I'm sure that it's child abuse," is what the answer is. So it's still there, I'm afraid. It's still out there.
Needless to say, these theories had, and may still have, a negative effect on families. Parents were stigmatized and burdened with guilt and shame for their alleged failure to communicate with or parent their children. And because they were supposedly at fault, some parents were patronized, ignored, or purposely left out when decisions were made about the care of their child. This occurred despite the fact that they were usually the primary caregivers.
In the very beginning, when the doctors were diagnosing him, they literally would not look at us. It was something that they had trouble apparently living with, or they had not had that much experience with working with families at all. It was them sort of and us. And of course the confidentiality thing, where they did not want to tell us all of the information that we needed. And we weren't asking for any revealing of any communication of a personal sort. That's not what we were interested in. We were interested in what the diagnosis was, what the options were, what the medications should be. Those things really weren't forthcoming. It was sort of a patriarchal system, like, we know what to do, don't you worry about it. And maybe inferred you caused enough problems anyway.
Liz Davis, mother of a son who has schizophrenia, discusses her experience.
I went to the Glendale Public Library and I checked every book that they had on mental illness. And all of their material was extremely dated. And so I got all of these awful horror stories about the schizophrenogenic mother, the environment in the family being the cause, poor communication being the cause. And then of course this really gives you guilt feelings, and you look back on your life and you think, what did we do? When did we do it?
When doing a puzzle, you can get thrown off and lose a lot of ground by a piece which superficially seems to fit, but doesn't. Stress, such as from family problems or overwork, was also thought to cause the disease. However, this too has been disproven.
On my back.
Although stress does not cause schizophrenia, we do know that once the person has schizophrenia, stress does have an impact on its clinical course.
What? What do you mean you don't have time? I don't care if you don't have time. I have a busy schedule too.
Stress can increase the chance that a person will have a relapse of symptoms and require hospitalization. Bill Davis, former president of the California Alliance for the Mentally Ill, discusses the effect of stress on his son who has schizophrenia.
We make arrangements to go to a party with relatives, people that he knows, which should be the least stressful kind of a party. And just the fact that there's a lot of people around and a lot of noise and talking, you can see frequently that it changes him insofar as he becomes nervous, agitated. Sometimes the hallucinations will even come back because we can see that he's speaking to himself or speaking to someone that's not there.
In recent years, the focus has shifted to implicate biological factors as the cause of the disease. Some of the information pointing to these factors has been known for decades. For example, it has been long recognized that some individuals suffering from schizophrenia show certain neurologic signs, such as clumsiness and repetitive movements, more frequently than those who do not have the disease.
Patricia, I'd like to test your perception of right and left. So what I'd like you to do is raise your right hand.
Also, many individuals with schizophrenia have more confusion about left and right sides of the body. All of these signs were noted before the advent of psychotropic drugs, so they can't be attributed to side effects of the medicine.
Patricia, I'd like to test your eye movements.
Abnormalities in eye movement are frequently seen in schizophrenia, as well as in other serious mental illnesses, such as manic depressive disorder. About 65% of individuals with schizophrenia have difficulty maintaining a smooth eye motion while visually tracking an object. In contrast, only 8% of the general population have this problem. An interesting fact is that this tracking problem is also found in 45% of first-degree relatives of individuals with schizophrenia, even though they do not have the disease. There are other eye signs that may be seen as well. such as increased or decreased blink rates, and inequality in the size of the pupils.
Patricia, what is that on your arm?
What? Oh,
Can you raise the sleeve up a little bit higher? What is that?
it looks like a bruise.
Also, it has been noted that a small number of persons with schizophrenia have a higher pain threshold than persons without the disease. They can sustain severe injuries or illnesses and not feel it. This has implications for caregivers and others who interact with individuals with schizophrenia. They must carefully assess the person and be alert for objective signs of injury or illness, and not rely on complaints from the person to signal that medical attention is needed. Neurologic signs, then, suggest a biological basis to schizophrenia. This theory is strengthened by studies which show genetic factors are involved. Again, these findings have been known for decades. Studies of families have shown that offspring of one parent with schizophrenia have a 13% chance of developing the disease, versus a 1% chance in children from healthy parents. When both parents have schizophrenia, the chance of the child developing the disease is 46%. Adoption studies also suggest the influence of genetic factors. Children who were born to parents with schizophrenia, but who were adopted at birth by families who did not have schizophrenia, still continued to be at an increased risk for the disease, even though they had little or no contact with their biological parents. Studies of twins also suggest a genetic influence. When one monozygotic or identical twin has schizophrenia, the other twin has a 30 to 50% chance of developing the disease. Yet, the fact that half or more of these other twins who have identical genes do not get schizophrenia is evidence that other causes, such as environmental factors, infectious organisms, toxins, or trauma, must also be considered. We've already noted that some unknown environmental agent may be the cause for individuals raised in urban areas to be more likely to become schizophrenic. Evidence also suggests that an unknown environmental agent may affect a person at a very young age, for example, in the second trimester of pregnancy or during birth, and cause that individual to develop schizophrenia later in life. This hypothesis is strengthened by the fact that individuals who later develop schizophrenia are 2 to 3 times more likely to have been born to women who had problems in pregnancy, such as bleeding, or who had a difficult birth, causing the baby to have a lack of oxygen. The infectious organism hypothesis is bolstered by statistics showing that individuals with schizophrenia are more likely to be born in winter or early spring, times of the year when the incidence of viral infections is highest. Researchers for years have noticed that persons with schizophrenia have had a higher incidence of minor anomalies, such as low-set ears, and minor deviations in fingerprint patterns than those without the disease. Such deviations often arise from subtle damage to the fetus from infectious agents or toxins. So now we have a few more pieces to the puzzle. So far, we have explored neurologic findings, focusing on those that are more common in individuals with schizophrenia. We have seen that genetic factors are definitely involved, with the disease having a tendency to run in families, and we have explored factors in the biological environment. And yet, blanks remain in the puzzle. In the late 60s and early 70s, researchers began to focus on the brain's biochemistry. In particular, neurotransmitters, chemical substances that permit communication between nerve cells. The neurotransmitters activate specific systems within the brain, particularly in the areas which govern the control of emotions and attention, 2 areas that are believed to be disrupted in schizophrenia. Originally, the studies focused on the neurotransmitter dopamine. Individuals who took overdoses of amphetamines, which stimulate the production of dopamine, had symptoms similar to those of schizophrenia. Also, it was noted that certain drugs, such as chlorpromazine, used to reduce the symptoms of schizophrenia, block the action of dopamine. Therefore, it was logical to focus on abnormal dopamine activity as a factor in schizophrenia. Although the study of this neurotransmitter and its pathways appeared promising, the pieces still do not fit. While dopamine abnormalities have been shown, it's not well understood how they contribute to the disease process. It may be that other neurotransmitters, such as serotonin, have a role in schizophrenia, perhaps in an interactive way with dopamine, or that abnormalities in dopamine accompany more fundamental disturbances in the brain. The study of dopamine continues. And the search has widened to include other changes in the brain's structure and function. This research has been given a huge boost in the past few years with the advent of sophisticated neuroimaging devices which give scientists access to data previously inaccessible. In particular, studies have focused on comparisons of the brains of individuals with schizophrenia and those without the disorder. Many profound differences have been found. Psychiatrist Julie Oldroyd discusses one important study, a comparison of MRI images of identical twins, which under normal circumstances would be identical.
These are two MRIs of identical twins. This twin is normal, and this twin has schizophrenia. This area is called the ventricle. The ventricle is an area in the brain that's filled with fluid. As you can see, in the normal brain, the ventricle is of normal size. However, in the schizophrenic brain, the ventricle is somewhat enlarged. The enlargement is thought to be due to the cortical changes located in this region of the brain. It is thought that the cortex decreases in size, thereby causing the ventricles to enlarge. When the cortical material is reduced, there are changes that are seen clinically. Some of the changes include decrease in the amount of speech, information processing changes, and difficulties in thinking.
Other structural abnormalities have also been found, some of them involving the limbic system, which could result in inappropriate behavior and profound changes in emotions, and regions of the temporal lobe, which may be responsible for auditory hallucinations and thought disorders. Tests on the function of the schizophrenic brain have also revealed abnormalities. Dr. Oldroyd discusses one of these.
This is a positive emission tomography scan. Another name for that is PET scan. It measures activity in various parts of the brain. Radioactive glucose is injected into the vein while the individual does a task, whereby individuals will perform a cognitive exam under a timed condition. The PET scan of a normal individual would light up red in the frontal cortex region. In a schizophrenic brain, the area would be a different color, possibly blue or yellow, indicating less activity in the frontal cortex.
Studies of information processing of individuals with schizophrenia have also given researchers useful data. In testing identical twins, one of whom has schizophrenia, it has been observed that the affected twin cannot perform as well as the non-affected one on tests which require problem solving, novel thinking, and grouping objects and ideas by form or meaning. Such deficits are found in individuals known to have widespread brain damage. Other findings of the information processing studies conclude that persons with schizophrenia do not do as well as others when they are forced to deal with multiple tasks, have distractions, or have a large volume of material to process.
It seems as though when they are really struck heavily with schizophrenia, as our son has been, that their cognitive skills are so depleted for whatever reason that they just haven't got the coping skills for instance, concentration. Our son had been, early on, had been given some very menial jobs, if you will, like parking cars in a car lot, and he wasn't able to understand which car he should move to what spot. simple things like that.
This has implications for those who educate clients. Individuals with schizophrenia have the same educational needs as others with long-term illness, such as diabetes. However, they require specific education adapted to their specific learning difficulties. An interesting finding is that many of the learning deficits are also found in lesser degrees in close family members who do not have schizophrenia. This tends to rule out speculation that the deficits are caused by medication or by the clients having been institutionalized, and strengthens the argument that genetic factors are somehow involved. We have now added more to our puzzle, exploring structural and functional changes, including biochemistry, and we've discussed deficits in information processing. Although pieces are still missing, much information has been accumulated. It is now known that schizophrenia is a biologically based illness, a brain disease just as Alzheimer's disease is a brain disease, and is not caused by faulty family communication or poor parenting. With continued research, more of the information on the causation of schizophrenia will be gathered, until all the pieces will eventually be found and fit to complete the puzzle that is schizophrenia.